Hi, today we're going to be talking about PTSD and depression in veterans and the different benefits that you can get for these conditions. So we hope you'll join us. Hi, and welcome back to Hill and Ponton's VA Disability blog. I am Natalia Joffrey, the company COO.
And I'm attorney Melanie Williams.
And today, Melanie's going to be talking to us about PTSD and depression in veterans. I know these are very hot topics, Melanie. So I guess we can start with the basics of what is PTSD.
Yes, so PTSD stands for post-traumatic stress disorder. It's basically when you have difficulty recovering after experiencing or witnessing a traumatic event. So there needs to be a stressor. That's the traumatic event where you either are exposed to the actual or threatened death or serious injury, or you witness it happening to someone else. Some typical examples that we think of are combat, car accidents, sexual assault. Each of those can serve as stressors that then cause symptoms of PTSD, but the symptoms have to cause impairment in social or occupational functioning. So basically, if you have symptoms, but it's not really affecting you, that's not going to be PTSD. And these symptoms have to last more than 1 month in order to be diagnosed as PTSD.
I'm glad that you gave those parameters because I know that with veterans, we do hear a lot about PTSD, and sometimes people don't realize that there is a certain criteria that you need to meet in order for the diagnosis of PTSD and for the VA to consider it a condition you can actually get benefits for. So here comes the next question. What is depression? And can you give us similar parameters for depression?
Yes, so depression is a persistent feeling of sadness that causes significant impairment of daily life. Some of the symptoms of depression are going to be loss of interest in activities that you used to enjoy, changes in sleep, so if you have insomnia or excessive sleeping, change in appetite where you're excessively hungry or you lose your appetite, and then that could lead to weight gain or weight loss, changes in energy levels, so extreme fatigue, lack of motivation, anxiety, apathy, hopelessness, mood swings, excessive crying, and even thoughts of suicide.
And I guess that's why so often buddy statements are used in these cases, because we hear about this a lot, don't we? Where they'll say the person used to be, outgoing and want to go to places and do all sorts of things and was very vivacious. And now, since a certain event happened in their life or since service, all of a sudden they're withdrawn, don't want to go anywhere, don't really want to talk to anyone, don't really want to do anything. We hear a lot they went from being an extrovert to an introvert, things like that.
Yeah, and a lot of times it's symptoms that veterans may not necessarily notice in themselves, but other people do notice. Like specifically with PTSD, irritability is a big one where, you find yourself getting angry about small things, and it's explosive anger and can be violent or aggressive. And sometimes you may not see how your reaction is impacting other people, but everybody else around you can see it.
Yeah, it's almost like it's always something or someone, and you don't realize at one point that stops being normal, that it can, that just seems to always be a trigger. How common would you say it is in veterans for them to have PTSD, depression, or both?
With PTSD, it varies widely among the different wars and eras. So one study shows that in Vietnam veterans, 15% are diagnosed with PTSD, though it's estimated to be higher, like around 30%, just because it needs to be diagnosed. In order to be diagnosed, a veteran has to go get treatment. So the numbers are likely much higher. Among Gulf War veterans, it's about 12%. Another study says that Iraq and Afghanistan veterans, they're about 60,000 or 13.5%. While other studies say 20 to 30. Another study says that over the past 13 years, 500,000 troops have been diagnosed with PTSD. So
Wow.
It's going to vary depending on the war, just because of the different tactics that were used tend to have different trauma exposures to the veterans. But again, the numbers are going to vary so much because it's so subjective. It's, a veteran has to go get treatment to get diagnosed to then know who has the PTSD. So the numbers are likely a lot higher than what we see.
And I think that we're much more educated now. I feel as if though, now there are open discussions about PTSD. A lot of veterans openly tell you, I have PTSD or I have depression, but I don't feel that that was the case with the Vietnam veterans.
Exactly.
for that, you know? And so I know when I used to do events, I would meet a lot of veterans and, you know, they would be getting 10% for tinnitus. And yet you would talk to the spouse and it was they clearly did suffer from depression and PTSD and had all of these symptoms, but they had gone once to the doctor or a couple of times, never wanted to discuss it again. They were very withdrawn and they could be 20, 30 years out of service and not getting any benefits for PTSD. Maybe not even ever diagnosed for PTSD, because it's almost a situation as if, you know, if you're not the one that's bringing it up and talking about your symptoms and the problems that you're encountering in your daily life, it's not like the doctor's going to volunteer to help you with that either.
Right.
Do you see that a lot in your cases?
Yes, absolutely. A lot of times veterans don't realize that the combination of all these symptoms is a condition. So I'll ask them questions such as, you know, do you find yourself overly suspicious or, you know, even to the point of paranoid that someone might come and attack you? For example, a lot of veterans throughout the night are constantly checking the locks around their house, or before they go to sleep, they walk around the perimeter of their house to make sure everything's okay. Or when they go to a restaurant, they always have to sit with their back against the wall and always looking
Yes.
at the door to see if someone's going to come in. And when I ask these questions is when they start to realize, oh, I thought that was just me. I didn't know, you know, and kind of putting all those pieces together shows, no, yes, that is an actual condition that can be diagnosed. The other thing is that PTSD wasn't considered a formal diagnosis, or it wasn't really considered a condition until about the 80s. So that's why with Vietnam veterans, it was called things like shell shock, where now it is considered an actual diagnosis. It's understood better. And so a lot of veterans, you know, before they get out of the service, they're screened for things like that. So that's why we see it more now.
It's so sad. You know, there's one particular veteran that comes to mind, and I'm sorry, I always get choked up when I talk about him, but I met him at at an event, and he was getting some minimal percentage. And I mean, he was so devastated by his initial encounter with the VA. He had opened up about what had happened to him in Vietnam, and they really were very dismissive of how he felt, what he went through, the problems he was having when he came back home. And it was so devastating for him, the manner in which he was treated. He almost became mute. Like he wouldn't talk. I mean, it was such a bizarre exchange. And as a matter of fact, the only reason I even had an exchange with them was because the wife was doing the talking for him. The only thing that he was even able to utter to me was, I will not talk to the VA. I mean, he could not even bring himself to have to talk to them because he had been so mistreated. And I think that unfortunately, a lot of Vietnam veterans and veterans from that era suffer in silence for years and don't get the benefits that they should receive because of that horrible treatment that they endured when they came back. But truthfully, they are entitled to those benefits. So it's sad. And I hope that as we put this information out there, they know that just because you were once denied, or because people were once poorly educated, or because you were previously mistreated, it doesn't mean that that's going to continue to be your same experience. And even though the VA many times doesn't get it right, or the VA doctors aren't the best, you should still get what you're entitled to. You know, you should not let this mistreatment continue, because to me, when a veteran is not getting the benefits that they should be receiving, it's as if though that mistreatment continues. You see them living in poverty or near poverty, and, you know, they get these 10% benefits. They can't live on that, clearly. And so it's almost as if though the whole family ends up suffering in silence because of these traumas that they endured.
And it's frustrating that, you know, in order to get service connected, they do have to talk about the trauma and the stressor that
Yes.
happened. And that in and of itself is difficult, because a symptom of PTSD is that you want to avoid anything that has to do with the trauma, anything that reminds you of it. And so talking about it and having to almost live through it again is difficult. And so for the VA to then deny after that is really disheartening. But, you know, we provide hope to so many veterans, and there is
Yes.
hope. It can be done. It is possible.
And I think that too, you know, you and some of the other attorneys, we always talk about the buddy statements and how effective those are, so that, you know, they can have fellow soldiers talk about what their experience was in service. Their spouses talk about what their daily activities and daily living is like with these conditions. And I love the example that you gave about when they go to a restaurant and their back needs to be to a wall. I have seen so many veterans light up when you give them that example, because it's like you said, they say, I thought that was just me. They think
Yeah.
this is normal, this constant being on guard or being concerned about what can happen. And the reality is this happens pretty commonly amongst veterans with PTSD, right?
Yeah, that specifically is called hypervigilance. So that's one of the criteria that defines a PTSD diagnosis.
You're so smart. You know the terms for everything. I love it. So, since we're talking about all of these, is there particular evidence that you would recommend in order to prove these types of claims?
Yeah, so you want to go get treatment. As soon as you start noticing these symptoms, people around you start noticing these symptoms, you want to go get seen by a doctor, and those medical records are going to be what you're going to want to submit so that you can show that there is an actual diagnosis. You'll also want to show evidence of your stressor, what traumatic event it was that caused this PTSD, and then have the doctor provide a nexus or a link between the two. And if it's depression, it's going to be the same thing as far as showing that you have a diagnosis. There may not be a specific traumatic event that caused the depression, but you'll still want to explain, if there was something that happened in service, if it started in service, and have something so that the doctor can link your current depression to your service.
And Melanie, in order to get benefits, you can have one, the other, or both. Is that accurate?
So you will only get rated for one mental health condition.
Okay.
They will not give you a separate rating for different mental health conditions. It's just one.
But you don't have to have PTSD and depression. If you have PTSD alone, is that sufficient for you to get a service-connected rating?
Yes, yeah. So you can be service connected for different mental health issues, not necessarily PTSD. So yeah, you can have just one condition and apply for that and receive your rating for that one condition.
How does the VA rate mental health? Because I know from talking to you and the other attorneys, lots of times there's a cap. I know with tinnitus, it's 10%.
Right.
So how is mental health rated, and are there any caps on these benefits?
Yeah, so there are specific ratings that they will assign for mental health conditions: 0%, 30%, 50, 70, or 100. So your symptoms have to fall within one of those categories, and it's going to be based on how much do your symptoms affect your ability to function, both socially and occupationally. So basically a 0% means doesn't have any interference, you're fine. 30% is if you have mild symptoms or they kind of come and go, and so only when you are in a stressful situation do they kind of manifest. 50% means it causes reduced reliability or productivity. That's the actual language that they use. 70% is when it causes a deficiency in most areas of your life, such as work, school, family, things like that. And then 100% is total occupational and social impairment.
I think you answered this, but can you get VA benefits for PTSD and depression at the same time?
No, so they will only assign a rating for one mental health condition. Now, one thing that we haven't talked about that to keep in mind is that a lot of times a veteran can have what's called comorbid conditions. So they can have two different conditions at the same time, like PTSD and depression. You
Right.
can have both. A lot of times the symptoms overlap. Actually, about half of the people who have PTSD also have depression. However, you will only get rated for one.
And can you get unemployability? One of the other attorneys and I were talking a couple of days ago about unemployability and TDIU, which is, tell us again, what does TDIU stand for?
Total disability based on individual unemployability.
Okay, you get
Just another
that.
name for it.
Okay, so it's another word for individual unemployability. Is that right?
Correct. Yes.
Okay, so can you get those benefits for PTSD and depression?
Absolutely. So mental health conditions can be severe enough to where they affect your daily life and your ability to work. So remember, with TDIU or IU, whichever you want to call it, you have to meet certain percentage requirements. So you have to have either one disability at 60%. So if you were rated for mental health condition at 70%, then you qualify for IU. And if you can show that that disability prevents you from working or from maintaining what's called substantially gainful employment, then you qualify for IU. The other way that you qualify is if you have a combined rating of 70% and at least one condition at 40%, that's the other way that you would be eligible. And so again, the key thing is showing that you can't work because of your PTSD or depression.
Super informative, Melanie. Thank you so much.
Thanks.
Please stay with us. Melanie and I are going to do another video here shortly. But in the meantime, if you have any questions or concerns, we hope that you'll visit the website or call our office. Thank you.